So, we've all heard the economic arguments against socialized healthcare. If I'm not paying for my own healthcare, then I'm going to use more of it than I otherwise would, and people are just going to be going to the doctor all the time, and then the price is going to go up, and there are going to be shortages of doctors because they're not going to be able to meet the demand, and it's going to be bad. Yes, it's bad. Now, this may or may not surprise you, but this actually is not the worry that keeps me up at night when I think about socialized healthcare. And yes, I do stay up at night thinking about socialized healthcare. If you live in DC, you're saying, of course, who doesn't? But if you don't live in DC, you might think that's kind of weird. Then you should just move to DC and get a taste of it and then go back home, because no one should actually do that their whole life. But we could spend a few years here and there. What I do worry about, however, is the disturbing relationship between socialized healthcare on one hand and nanny state-esque regulations on the other. This concerns me. If I am paying for your healthcare, suddenly I have a vested interest in whether or not you are healthy. You being healthy is no longer about you being healthy. You being healthy is about you not spending my money. That could sound like a good thing, right? Like, oh, they want me to be healthy, they want to help me, la-di-da-di-da. But it's not. Don't let them fool you. It is bad, bad, bad. What really is happening is not, oh, we want to help them, la-di-da-di-da. No, no, no. What it's really about is forcing people to make healthy decisions even when they wouldn't make those decisions on their own. I.e., it's about coercion. Let there be no doubt. It is about coercion and coercive power. Thus far, we've got smoking bans in bars and many public places, even open-air public places nowadays, cars, random places. We got trans-fat bans in restaurants. Like, it is nutty out there. It is a nutty, nutty world. And one of the reasons that it's a nutty world is because people know that if you screw up your health, they're going to have to pay for it. So, I know we're trained to be a little bit weary of the slippery slope argument. However, in this case, I think it's justified. Why? Because the government is already banning fatty foods. Can you think of any food people, sustenance. They're banning our sustenance. How long is it before extreme sports are banned? Snowboarding, bungee jumping, skydiving? There's no real reason that we should be skydiving. It's just for, like, weird people who like to, be in danger and stuff. Why should we let them do that when we're gonna have to incur the costs? That's a totally logical argument. They're totally gonna come at us with that crap. Worse yet, how long before they're in our bedrooms? A lot of money is spent on sexually transmitted disease. Mandatory condom use, anybody? So, in conclusion to my socialized healthcare little rant, nothing is free. Have you guys ever heard of the whole there's no such thing as a free lunch theory? You know, because if you go to lunch and somebody says it's free, you're still paying with your time. If you can't get free lunch, how can you possibly expect that you're going to get free healthcare? Come on, people. And free healthcare doesn't only come with economic costs. It also takes a toll on our liberties.